Good day everyone, I am Kier S. Manyalak, B.Ed 1C from Bataan Peninsula State University. So for today, we will talk about anxiety disorder. So before we start, let me define what is anxiety. Anxiety is a feeling of fear, dread, and uneasiness. It might cause you to sweat, feel restless and tense, and have a rapid heartbeat. It can be a normal reaction to stress. For example, you might feel anxious when faced with a difficult problem at work, before taking a test, or before making an important decision. It can help you to cope. The anxiety may give you a boost of energy or help you focus. But for people with anxiety disorders, the fear is not temporary and can be overwhelming. So, what is anxiety disorders? Anxiety disorders are conditions in which you have anxiety that does not go away and can get worse over time. The symptoms can interfere with daily activities such as job performance, schoolworks, and relationships. So, what are the types of anxiety disorders? There are three types of anxiety disorders: the generalized anxiety disorder, panic disorder, and phobias. First, let me explain what is generalized anxiety disorder. Generalized anxiety disorder, or GAD, people with GAD worry about ordinary issues such as health, money, work, and family, but their worries are excessive, and they have them almost every day for at least 6 months. Next is the panic disorder. People with panic disorder have panic attacks. These are sudden, repeated periods of intense fear when there is no danger. The attacks come on quickly and can last several minutes or more. And the last is the phobias. People with phobias have an intense fear of something that poses little or no actual danger. Their fear may be about spiders, flying, going to crowded places, or being in social situations, also known as social anxiety. What causes anxiety disorders? The cause of anxiety is unknown. Factors such as genetic, brain biology, and chemistry, stress, and your environment may play a role. Who is at risk for anxiety disorders? The risk factors for the different type of anxiety disorders can vary. For example, GAD and phobias are most common in women, but social anxiety affects men and women equally. There are some general risk factors for all the types of anxiety disorders, including certain personality traits such as being shy or withdrawn when you are in new situations or meeting new people, traumatic events in early childhood or adulthood, family history of anxiety or other mental disorders, some physical health conditions such as thyroid problems or arrhythmia. What are the treatments for anxiety disorders? The main treatments for anxiety disorders are psychotherapy, talk therapy, medicines, or both. Cognitive behavioral therapy is a type of psychotherapy that is often used to treat anxiety disorders. CBT teaches you different ways of thinking and behaving. It can help you change how you react to the things that cause you to feel fear and anxiety. It may include exposure therapy. This focuses on having you confront your fears so that you will be able to do the things that you had been avoiding. Number 2 is medicines. To treat anxiety disorders include anti-anxiety medicines and certain antidepressants. Some types of medicines may work better for specific types of anxiety disorders. You should work closely with your health care provider to identify which medicine is best for you. You may need to try more than one medicine before you can find the right one. How can other people help to someone with anxiety? It can be really difficult when someone you care is experiencing anxiety or panic attacks. But there are things you can do to help. Here are some tips. Don't pressure. How can other people help to someone with anxiety? It can be really difficult when someone you care about is experiencing anxiety or panic attacks. But there are things you can do to help. Here are some tips. Number 1, don't pressure them. Try not to put pressure on your friend or family member to do more than they feel comfortable with. It's really important to be patient, listen to their wishes, and take things at a pace that feels okay for them. It's understandable to want to help them face their fears or practical solution, but it can be very distressing for someone to feel they're being forced into situations before they feel ready. This could even make their anxiety worse. Try to remember that being unable to control their worries is part of having anxiety, and they aren't choosing how they feel. Helping someone who is having a panic attack. It's understandable to feel frightened if someone you care about experience a panic attack, especially if it seems to happen without warning, but it can help if you try to stay calm, gently let them know what you think they might be having a panic attack, that you are there for them. Encourage them to breathe slowly and deeply. It can help to do something structured or repetitive they can focus on, such as counting out loud or asking them to watch while you gently raise your arm up and down. Encourage them to stamp their feet on the spot. Encourage them to sit somewhere quietly where they can focus on their breath until they feel better. You should never encourage someone to breathe into a paper bag during a panic attack. This isn't recommended and it might not be safe. Be kind, be non-judgmental. Let us know it will pass. Let us know you are there. Ask how you can help. Your family or friend may already know how can you support them. For example, helping them with difficult situations, taking them calmly, or doing breathing exercises with them. By asking them what they need or how you can help, you can support them to feel more in control themselves. Knowing that there is someone around who knows what to do if they start to feel frightened, panic, could help them feel safer and calmer.